Welcome to the She Found Motherhood podcast. Today, we're going to do a podcast about something we actually get asked a lot about on our Instagram channel, how to choose a care provider. So choosing a care provider is one of the first major decisions you make during your pregnancy, and it is an important one. On today's podcast, we're going to review the different care provider options, how different communities may work in terms of options, and how to choose the right care provider for you in this pregnancy. Now, keep in mind, we work in Victoria, British Columbia, and have a pretty special system here, which is not typical of many communities. So we will try to present this as generally as we can so you can apply it to your community, but we may not totally understand how each community works.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it. So first thing we need to discuss is what are the options for a care provider? Most communities have some combination of three different options: midwifery, family practice, or obstetrics. We will go through each type of provider in detail to talk a little bit more about each of those groups. Again, please keep in mind that we come from a family practice lens, but we do work closely with both other types of care providers in our community. There is an underlying expectation that all types of care providers provide the same basic standard of care to all pregnant patients, regardless of where you are or who you choose as your care provider. You should ensure that your care provider you are considering is licensed to provide pregnancy care and in good standing. You can look this up through their regulating college. In BC, that would be either the College of Physicians and Surgeons of British Columbia or the BC College of Nurses and Midwives. There are other care providers who may support you through your pregnancy, which we can touch on briefly later, but they're not medically trained to support you through your pregnancy, childbirth, postpartum journey independently. These may include our allied health colleagues such as physiotherapy, naturopath, chiropractic, or dietitians, and this also includes the group of doulas. They are not specifically trained in supporting pregnant people and their partners through childbirth and postpartum from a medical perspective, but they do have a lot of value to add in helping to support pregnant and newly parenting people from more of a social and supportive role.
Okay, so first up, let's talk about midwives. Midwives are medically trained in healthy birth and pregnancy. They generally complete a 4-year degree, which covers caring for low-risk pregnant and postpartum people, as well as the childbirth period. Some midwives have done education prior to starting midwifery school, like nursing or other undergraduate training, but some have no prior medical training. Training programs also differ from country to country. Midwives have a defined scope of care within which they must work, and if patients are medically complex or become medically complex, then they either share care with a specialist physician or transfer care to a family doctor or obstetrician, depending on the circumstances and the community. The midwifery model is unique in that it often offers longer appointments than family physicians or obstetricians, although not necessarily if that's not something you're looking for. They also offer home births, if that is your wish. And some midwives will even come to your home after birth and do some checks on you and your baby. In our community, we're really lucky to collaborate really well as a group, so the need to transfer to another provider is much less, as our obstetricians will provide shared care for more complex pregnant patients, so the midwives in our community are still able to support the normal parts of the pregnancy. This is often the case for us as family physicians as well. In terms of how midwives work, midwives can work solo, or they can work as a part of a group who work together to provide shared care for a community of clients. These groups generally tend to be a bit smaller than physician groups, so up to 4 in care at one time, so all of whom must be known to the client. Each midwife can care for up to 40 clients per year.
So now we're going to talk a little bit about family physicians, which is what Dr. Sarah and I are. And generally, most family physicians who provide maternity care are specialized in maternity care. In some communities, you might follow along with your regular family physician until about 20 weeks and then transfer to a specialized either midwife, family doctor, or obstetrician. In our communities, we generally start to see our pregnant people at about 6 to 8 weeks of pregnancy and care for them all the way through to 2 months postpartum. So, training for family physicians is most likely at least 4 years of an undergrad degree, 4 years of medical school, and then at least 2 years of residency training. Some of those residents who are interested in maternity care tend to spend a lot more time during their residency focusing on that. And some actually do extra focus training after finishing their residency program to further hone their skills. Some family physicians in rural areas do extra training to do epidurals and cesarean sections, as well as assisted vaginal deliveries, if there is a need in their community to do so. Family physicians generally have a much broader medical training than both midwives and obstetricians, so are able to help support pregnant people with the medical needs that are outside of their pregnancy, such as mental health concerns and prescribing medications, thyroid issues, migraines, bowel concerns, etc. This generally means less visits to your own family doctor during your pregnancy. We are also trained in more complex care of postpartum issues and newborn issues such as high blood pressure, poor growth in infants, and so we're able to care for a broader spectrum of patients during this period. The amount of patients family doctors care for annually can vary hugely. Some family doctors only provide maternity care for those patients in their own practice, so they may care for 10 to 20 patients a year. Some providers only do maternity care, so can provide care for up to 100 patients or dyads a year. In our group, we care for each, and so we do about 60 to 70 per provider per year and the same amount of deliveries. Again, some family doctors are on call only for their own patients, and so you're pretty much guaranteed to see your family doctor during the delivery unless they happen to be out of town. But the majority of us now work in groups of 4 to 10 physicians to provide care for the patients that are under our groups.
And lastly, we'll talk about obstetricians. And I will share, some of you may not know this about me, is that I actually started my training as an OBGYN and did 2.5 years of obstetrics and gynecology residencies. Alicia and I really have a lot of knowledge around what training goes into family medicine and obstetrics. So to become an obstetrician gynecologist, you need a minimum of generally 4 years of your undergrad, 4 years of medical school. You then do 5 years of residency, and some do a few extra years of training on top in high-risk pregnancies. And these physicians are known as maternal fetal medicine physicians or perinatologists. It's really important to note that obstetricians do not care for newborns, so you will either need a family doctor or a pediatrician to provide newborn care after your delivery. In terms of the model of care obstetricians provide, it's very similar to a family physician. We see you in office visits, we attend your birth in the hospital, and do postpartum visits for maternal health in the office as well. In terms of an obstetrician's scope of care, obstetricians can care for all pregnancies, even very high-risk pregnancies, and they can care for them starting at an early gestation. So the same as a family doctor, anywhere after that sort of 6 to 7 weeks mark. Again, it's just important to know that they do not do general medical care, so you might need to see your family physician during your pregnancy as well for non-pregnancy related conditions like asthma, acne, etc. Now, it's really hard for us to comment on the amount of patients per year, as I think it's quite variable and it really depends on the community. In Victoria, we have 0 obstetricians that do any uncomplicated pregnancy care per year because that's not how our model works. You might want to ask the providers in the community that you're in how many they care for in a year if you're curious and looking into different care providers. Most obstetricians do group practice. What this means is that you'll generally see 1 or 2 obstetricians in the office, but they rotate through a group on call, just like family physicians, where there's generally anywhere from 4 to 8 or 9 obstetricians that you might see during your delivery.
Is this pain I'm feeling in my pelvis normal? Should I do genetic testing for chromosomal differences in my baby? Is it safe to go to the dentist while I'm pregnant? Doctors and maternity specialists Sarah and Alicia are here to empower you with even more knowledge so you can have the best pregnancy, birth, and postpartum experience you can. Presenting the Pregnancy to Parenthood podcast, a new series of informative episodes geared week by week toward whatever trimester of pregnancy you're in. Tune in weekly, following along relevant topics as we move through pregnancy, or just binge listen and come back to the episodes you found most helpful. Access the full series for a full 2 years and listen to it on your own time. To learn more, go to www.shefoundhealth.ca or click the link below.
Now we'll touch briefly on place of birth. In Canada, our two general options are at home or the hospital. In other countries, they may have a birth center as well. Your provider might have privileges at some, while others do not. So this is something you might inquire to as well if you're interested in having a birth in a birth center, at home, or the hospital. Does the care provider you're looking at have privileges at the center where you want to give birth? In terms of what type of birth providers are able to support, only an obstetrician or a family physician specifically trained to do cesarean births can provide cesarean births. Family doctors mostly assist, and in some communities, midwives are trained to do the assisting as well during the surgeries. If you have a midwife and you have a cesarean birth and your midwife is not trained to assist, they can absolutely be present to be supporting you during your cesarean birth. It's really important for us to say that your mode of birth preference should not dictate your care provider. If you're planning an elective cesarean birth, you absolutely can have a midwife if you choose, except perhaps home births. We are not trained to do home births, so we would not be able to provide your maternity and birth care.
And there are certainly more and more birth centers that are popping up in Canada.
Ooh, I didn't know
Yeah,
that.
it's just a bit of a newer phenomenon. So that's something to keep in mind as well. And again, it might dictate who you would choose to care for if you're choosing to do a birth center delivery. So another piece of the puzzle, which can be a bit challenging to suss out in the early stages of your pregnancy, are values. And this is an incredibly important piece for many people. And you should really think about what are your values in your upcoming pregnancy and childbirth experience that are really important to you when you're making this decision. So some of the values that we think are important in the care of our patients are evidence-based choices, medically sound, collaborative, good communication, informed decision-making. And Dr. Sarah and I work together on a team, and we've chosen to work with the other members of our team because we all have a same shared value system. So regardless of who you might see in your childbirth experience, you're going to get the same type of care from all of us, which is a really important thing. So how can you figure this out? You can look at their websites or if they have a social media presence. Do they share high quality information? Do they seem to work well with their colleagues from other fields? Are they respectful in how they communicate? Most of us are professional and want the best for our patients and clients. But every once in a while, there can be somebody who tries to influence people negatively about other professions. And this really should be a red flag. This is not a competition. We are all in it to provide good, holistic, evidence-based care for our patients. And so if somebody is talking negatively about a different profession, then you may want to take a second look.
Mm-hmm.
And really, you never know when you're going to need the
I
help
love
of a
this
colleague.
story.
And so it's important to be able to communicate and collaborate and work well with all of your colleagues. So Sarah's laughing at. So I was on call at the hospital the other day. This happened maybe 1 or 2 weeks ago. And I was literally walking out the hallway to leave. And a woman came in, a pregnant person came in rip-roaring labor into the hospital room. Now, most of us do call from home. And so I just hung back to see what was going on. And it turns out her midwife was at home and was on her way in, but it was going to be about 20 or 30 minutes until she got there. And this patient was not going to wait. So I got changed. I got changed into my scrubs and I went in and I delivered the baby while the midwife was coming in. As soon as the midwife got there, she took over. I went home and the next day we saw each other in hospital and she thanked me for doing that. And I said, of course, you would do the exact same thing. So that wasn't the midwife's plan. It wasn't my plan. And it certainly wasn't the patient's plan. But because we as a group work so well together and collaborate and learn together, it was fine. And it all worked out in the end.
Yeah, I love that story. And it's so true. You could probably find almost a story a day where we're supporting one another in our center. And collaboration is just so important. And the last thing we're going to touch on is the coverage of cost. Now, we're really fortunate, as Alicia and I have mentioned, we live in Canada, and we have healthcare coverage that covers the cost of one care provider in pregnancy. This is generally limited to one, what we call MRP, most responsible provider. So you cannot be followed by a midwife and a family doctor, for example. But if your most responsible provider needs support to care for you, then a specialist can provide care around that specific issue, while your provider provides the general pregnancy care. So like Alicia mentioned, if you're seeing a midwife for your pregnancy, but perhaps you have a twin pregnancy, here in Victoria, you can continue to see your midwife for routine care, but the obstetricians will see you to provide that extra level of support that a twin pregnancy needs. In other countries, we would generally recommend to check in to see if your insurance provider will cover certain care providers, and also if you need to deliver at certain hospitals or birthing centers.
This is certainly not in our area of knowledge.
Yeah.
Just making sure that when you're thinking about care provider, you look into those things if they're applicable for you.
Okay.
So one thing Sarah and I just wanted to touch base on is a lot of people ask us, oh, can a doula care for me in my pregnancy? And absolutely, they can be a really integral part of your support team. But like we said before, they're not medically trained to provide pregnancy and postpartum medical care. Doulas are amazing and they provide excellent support during the childbirth experience and especially in those postpartum days. And they're a really valued member of the team, but you do need a primary care provider. So either an obstetrician, midwife, or a family doctor if you're choosing to get any kind of medical care in your pregnancy. In addition, the doula can be there to support you.
Yeah, and Alicia did a really great podcast with Jay. You have to go way back in our podcast archives.
Yeah, we can link it. We'll link it in the show notes.
Yeah, God, you're so smart.
I know. All right. Thanks, guys, for listening. We hope that helps just give you the landscape of care providers and how to choose a care provider who's right for you in your pregnancy. And we're really excited because if you found this useful, we actually have started a new podcast series, a Pregnancy to Parenthood podcast.
Pregnancy to Parenthood.
Which is a week-by-week podcast that talks about pertinent issues as they come up in pregnancy. So if that's of interest to you, check out our website, www.shefoundhealth.ca/courses, and you can sign up for that if that's something that you think would be valuable to you.
Thanks for listening.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.